Hello, everyone. Jonathan Edelheit from the Medical Tourism Association. I want to thank everyone for joining us today on our webinar on the coronavirus and its impact to medical tourism. And now we have a new name for it as of yesterday, COVID-19. So I thought that this was an important topic. It's getting a lot of coverage in the media. I think that there, some people are very knowledgeable about it. Some people aren't. I think there's a lot of people that there's, fear around it because there's a lack of knowledge, or it's unknown, or it's new. And so thought it was very important just to discuss it with a high level with some of the leaders and experts in the medical travel industry. And I'd like to introduce our panelists today for our fireside chat. I'm going to introduce each of them really quickly, and then I'm going to ask them to introduce themselves, which I always find a lot more engaging. So the first person we have with us today is Dr. Nizar Zain from the Cleveland Clinic. Maybe Dr. Nizar, you can introduce yourself.
Yeah, thank you for being able to join this wonderful panel. I am a director of the Liver Center at the Cleveland Clinic that oversees patients with liver disease and liver transplantation. I also serve as chairman of Global Patient Services, which is the entity responsible for caring for all international patients that come to our facilities. So I'm heavily involved in my administrative role in the care of medical travelers and medical tourism industry.
We also have with us Karen Timmons from Global Healthcare Accreditation. Karen, can you introduce yourself?
Sure, thanks, John. I'm CEO of Global Healthcare Accreditation Program for Medical Travel Services. This is a specialist accreditation program that does a deep dive on the medical travel or the Global Patient Services Unit for hospitals and clinics that serve and treat medical travel patients. So I'm delighted to be on the call today.
And Ran, we have Ran Yang from Sea Health.
Hi, thank you for inviting me for this webinar. I'm Ran Yang. I'm a founder and CEO of Sea Health. Sea Health is a medical tourism company that helps Chinese patients to go abroad for treatment for critical illness, especially cancer.
Great. So since we have a name for it, and now it's going to be starting to be called COVID-19, if everyone's okay with it, I'll just refer to it as that on the call. But feel free to use its, the name that everyone knows of it. So I'd like to kick it off with Dr. Zain, since he's the doctor in the room. So Dr. Zain, what is COVID-19?
Thank you, Jonathan. COVID-19 is a name that, as you stated earlier, that we have given this new virus about 24 hours ago. COVID-19 is a member of a family of viruses. We call them coronaviruses. Most known viruses in this group would be the common cold virus, would be the virus responsible for SARS and for the MERS, which is the Middle East illness that some of these appeared a decade or two ago. Members of this family typically or often can be transmitted from animals to humans. So they are heavily present in animals, but periodically they can be transmitted to humans, and they cause a number of non-specific symptoms. So all these viruses we mentioned, they all have something in common, that they all cause the typical flu-type symptoms, which is some fever, runny nose, cough. In the majority of patients, they will recover, but in some patients, it may cause a severe illness, a pneumonia-like illness, which leads to breathing difficulty. And as we know from the news, that some patients may actually die as a result of this infection. So it is important to remember that the very first case ever identified was on New Year Eve. So we are talking, all we know about it is about 2 months old, and not even quite 2 months. And there's a lot to be desired in terms of understanding how this virus is transmitted, and potentially how can we prevent it or treat it. But what we know for a fact that the first case and the cluster of cases happened in Wuhan in the Hubei province in China. So this is where the epicenter of this infection is. But since it has spread outside China in a limited fashion, I would say it is unfortunate we have to deal with this virus, but it also, there has been global effort to try to contain this epidemic, which has really already shown that it can slow it down in terms of speed of spreading.
And I think it's important that you mentioned it's an epidemic. It's not a pandemic yet, which is, pan around the world. It's an epidemic and an outbreak. I think a lot of people, get scared about, how can I catch it? I was just at one of the largest healthcare conferences in the Middle East, and you could see people just, they think, they're going to catch it. They get very nervous. They do a lot of things. How, at the end of the day, it's all about prevention. One, to keep oneself healthy, but to keep the spread of any type of a flu or virus from spreading. How should a patient protect themselves from catching this?
So with the limited knowledge we know, it will all fall under the same umbrella of other coronaviruses, in which these viruses spread from human to human through respiratory droplets. So sneezing, coughing, this type of activities. So typically we say you have to be in a proximity of about 6 feet away from somebody who harbor the virus in order to be exposed to it, because it's transmitted through human droplets. So in terms of prevention, and most important of which is common sense, that is frequent hand washing with water and soap, can significantly impact the spread of coronaviruses. There has been broader effort in terms of prevention on parts of patients in terms of travel bans, for example, that the US, for example, imposed on people coming from China. That is a public health type of prevention. But on the individual level, someone who is sick with the virus will need to be conscious, meaning stay home, don't go and mix with other people at workplace and so on. We tell people when you cough or sneeze to make sure you either cough or sneeze into a tissue paper or into the sleeve of the arm, not the hands, because that's how you transmit it to others. There is no recommendation to use masks on routine basis outside the areas of where the epidemic is. So there's no reason in a normal circumstances today for people to be wearing masks on day-to-day basis, but certainly if somebody have any symptoms of a cold or infection, they need to be wearing masks. So prevention is both ways. One, how to prevent myself from being exposed, but also if I am sick, how can I prevent others from being exposed to my respiratory droplets?
One interesting question that I have for you is, you were mentioning constant, frequent washing of the hands is important. Does every soap do that? Like if I'm staying in a hotel and I'm using the bar of soap they give you at the sink, versus, a liquid soap that they have, does that all work for any type of flu or virus, or is it a specific type of soap?
No, it is not specific type of soap. The most important thing is frequent hand washing with water and soap, or using alcohol-based hand sanitizers. But there is no data to support that this soap is gonna kill coronavirus more than the other, or is gonna prevent spread more than the other. The most important message here is frequent hand washing with water and soap.
And I might be getting more too technical for this, and this just may be for me personally, but is it cold water, hot water? How long? What if someone's a short hand washer versus a long hand washer?
Long hand washing, and actually it's hard on a webinar to go over detailed hand washing, but there are a number of videos one can watch that they would show the process of hand washing. It's almost like when you go to an operating room, the process of hand washing is significantly longer. Had to be careful about areas in the hand where it may not be directly exposed to soap in a quick hand wash. So it is longer, it is more detailed, it is more frequent. Absolutely. Yeah.
Karen, the question I have for you is, what does COVID-19 mean in like the global world that we live in today?
Well, certainly globalization in the last 18 years has encouraged companies to build relationships, to develop supply chains that cut across national borders. So economies are much more interconnected as our businesses. And we've seen that where international companies that are relying on Chinese factories to make their products and depend on consumers for their sales are starting to feel the impact of the virus. And as the world has become much more interconnected with dependencies, and as China has evolved into a principal element of the global economy, the epidemic is substantially more of a potential threat than SARS was in 2002 because of the increased globalization. So we have witnessed some of the supply chains in the automobile industry, as well as the food industries. When you think of how many international chains have restaurants in China where they have been closed. And also China is certainly a large consumer of products from around the world, and luxury goods in particular are also being impacted. And obviously, as Dr. Zain mentioned, with airlines curtailing some of their flights, dozens of global airlines really have slowed down, which impacts not only the airline industry, but also tourism, hotels, restaurants. So there's a chain reaction there. Actually, I was surprised when preparing for this that tourism accounts for 10.4% of the global domestic product and 10% of global employment. So that's a huge chunk. So obviously this is an evolving situation, difficult to predict where we will be in 6 months. But as we have learned from previous epidemics such as SARS and MERS, while there was a significant hit in the first few months of in the first quarter, within the next year, things were back to normal. And we obviously need to be paying close attention and be diligent. And this will have impact on the medical travel patient and industry as well. And we'll talk about that a little bit later.
Mm-hmm. Really quick, Dr. Zain, back to you. One question is, does a doctor need to do something differently to prevent for himself versus a patient, or is it the same?
No, when we talk about universal precautions, when we talk about avoiding being in a direct contact with somebody who is sick, I think that applies to physician. We do have standard procedures in hospitals to address these issues, not related to the corona per se today, because these are ongoing issues in healthcare. So as a healthcare provider, you are often exposed to patients with a number of illnesses. So we just follow same procedures, and there is no specific unique recommendation for corona as opposed to all other precautions.
And I think one statistic which is good to set the framework for where we're at with like COVID-19 is that the flu outbreak in 2017 had 60,000 deaths in the US and 500,000 global deaths. And right now with COVID-19, I know the number is growing, but it's north of 1,000 people. So it's rare that you see this on the news, because the news is more about the spread, fear factor, things like that. But the reality is the flu is more deadly right now than something such as this. And is there anything that you could put in perspective for us for that, Dr. Zain?
Yes, I mean, I think the statements you made are very important. part of the anxiety around coronavirus comes from the fact we don't know everything about it today. I think as knowledge emerge in the next weeks and months, we will get a lot more comfortable about what we can and cannot do to prevent spread of coronavirus. There's always a silver lining, even at the times of unfortunate epidemics of infections, and that is global collaboration. In fact, I was reading yesterday, sponsored by the World Health Organization, this meeting of the minds that took place in Europe. That's where the name COVID-19 was given, but also scientists from all around the globe met in one place to look at, including industry, to look at quick path to vaccination for coronavirus, quick path to treatment of coronavirus, quick path to all of that. And this is very encouraging because we are very early in this epidemic. As you said, we are talking about globally much smaller number than people infected compared to like influenza on year-to-year basis. The number of people who died from corona is much less than the ones who died from influenza, but yet we have a lot of effort put forward to support every country globally, including China, in trying to contain this epidemic. If you look at the US particularly, so we have, the last I'm aware of is about 13 confirmed cases of coronavirus. In this same in the past year, we had something the order of 180,000 influenza cases and thousands of deaths from influenza. We haven't had in the US a death from corona, and we're only talking about a handful of cases. So the magnitude is very different, and this is why important not to panic, but it's also important to understand more about this virus so we don't have to deal with a lot more people getting sick in the future.
Mm-hmm. And no, I definitely think one thing it does help is with awareness. I feel that people are more focused on hygiene and other things and prevention because of the global nature of the world that we're in today. So I think with this unfortunate circumstance, I think that it is going to help in making people more aware of the fact of how things could spread globally and how to prevent it. And I think the global collaboration amongst governments and everyone, it's really good to see with this, and because that is going to make a big difference in the future.
Actually, if you don't mind, I'm going to make one comment about we talked about public not to panic, about appropriate use of masks when needed, not random use of masks. Ironically, I was reading a couple of days ago about this quick mask wearing behavior. Somebody looked at it and they showing basically that when you do have a mask on, you are less likely to wash your hands anymore, less likely to be careful with prevention, and you are more likely to go into places where there may be somebody sick. So it gives you this false sense of being protected because you have a mask on. So this is where I say there's no benefit of panic and rushing into action. Rather be logic and understand what's the risk and what are the ways something get transmitted, and what we know about that could prevent that transmission, not just random behavior.
I think that's very good advice. That's very interesting too, because I think psychologically, a lot of people think of it as breathing in the mask, not the hands. So getting that false sense of confidence. So I'd like to shift over the next question to Ran. Since Ran, you're a medical tourism facilitator based in the U.S. and also in China, referring patients all around the world for medical travel. What is daily life like in China, and what is COVID-19's impact in China on daily life?
Well, China is definitely trying the best to control the spread of the virus. Starting end of January, people are required to stay at home. But starting from 2 days ago, besides Hubei province, other cities are gradually making people back to work because of the pressure of the economy, of course. But only for most likely people working for medical equipment company and those, but for schools and other industry, they're trying to work online. And people are still trying to be at home, and there are, for example, there are like drones outside in the apartment complex, kind of monitoring people who, if they are coming out of their home but not wearing a mask or for like no reasons, the drone will turn on like the loudspeaker and saying, go back to your home, and chasing after people to really go back to their home. And Chinese government also announced a couple new laws based on these virus condition. They are trying to prevent or to warn people who are, for example, hiding the symptoms and hiding their travel histories, and people who are selling food or medical equipment for much higher price, or people who are selling or buying exotic animals. So those things will never exist again in China, I believe. But gradually, day by day, we're watching closely of the number that are confirmed, or the death number. They're significantly decreasing every day. So still, people are very confident that it will be passed very soon. And a very small positive side of it also is it's Chinese New Year, and after people go back home, they're actually required to put in quarantine. And online service shows a lot of young people who are working or studying in another city, and they said it's the longest time they have been spent with family members, and they do feel that for first time they feel closer to their parents.
Very interesting. I know it's got to be very stressful to be, if you're under quarantine, for example, in Hubei province, it has to be very stressful. I have a colleague who was visiting his parents when it happened, and now, can't get back to Beijing until it's lifted. So one of the things that, I haven't seen any media outlet talk about, because I think they're more focused on, fear or just updating the numbers of infections or deaths in China, is the impact on people's health care within China. So for example, like what's going on with like cancer patients? Do cancer patients have access to go to the hospital to get their cancer treatment while this is going on?
Well, cancer patients are actually facing the, I would say the worst situation now, because hospitals, especially big top hospitals in China, who has the best resources and best or most doctors, they are all sending to Hubei province. Most almost like 40% of them are going to different cities in Hubei province to help them. So cancer patients are actually not allowed to be admitted in the hospital anymore, and all the existing patients, their treatment plans have been suspended for no clear date when it will be resumed.
That has to be very stressful if you're a cancer patient getting treatment and you don't have access to that anymore.
Right, patients are all concerning at home because they all the scheduled chemo or radiation therapy are just stopped there, and they're treating doctors, maybe they have the top doctors, but their treating doctors are all in different locations now.
And they're not being told like this is the date your treatment could resume, so they don't know if it's a week, if it's a month, if it's 3 months.
No, there's no clear date, and even the hospital are not sure. A lot of bed or rooms are occupied by infected patients or people who going to be infected, at advance. So there's no clear date yet.
Mm-hmm. Do they have any options, or they just have to sit and wait to see what happens?
Yeah, for existing cancer patient that's in the hospital, I don't think they have much options now, because even they trying to, for example, go to another city, all the highways and the trains are stop working actually. And if they're at home and was going to, nearby hospitals, that's, same issue.
Mm-hmm. I think, no, I mean, I think that's really important, because I think we're not seeing the human factor or the impact on this on just normal healthcare or people with serious or critical conditions that need care, and don't have access to care, which is even, makes it even more urgent, for us to find solutions and, and resolve this.
Yeah.
So Karen, coming back to you, are there any considerations regarding COVID-19 for the medical tourism industry?
Well, certainly, John, just as we mentioned earlier about globalization affecting many industries, those patients who are planning to travel across the globe have to be very proactive and diligent in whether or not they're able to continue their travel, not only due to the slowdown with respect to airlines, but also whether or not there is a risk of their traveling, and what precautions need to be taken. I think it's very important for patients, facilitators, buyers to be working with organizations that do have infection control policies and plans in place way before a pandemic or the spread of such a infectious agent is apparent, and really have a risk management plan in place as well, so that they can proactively plan for these events, and also have policies and procedures in place that require the following of instructions from the WHO guidelines or CDC or other national regulatory bodies that are collaborating right now together and are able to move forward and follow that. So it is very important. For instance, GHA in our accreditation, we do rely on the clinical accreditation of other agencies before we accredit them for their medical travel program. We're fortunate that Cleveland Clinic, for instance, is accredited by the Global Healthcare Accreditation, but it already has the Joint Commission accreditation, which really does a very broad infrastructure of quality and patient safety, and GHA does a deep dive. Now, GHA also, for instance, has some infection control standards that require the organization to be proactively looking at how it might be able to mitigate risks that a patient might be bringing into the organization, as well as protecting their own staff, their own healthcare workers from acquiring anything, and also whether or not that patient, to mitigate the risk that they're bringing something back to their home country. And this is on an ongoing basis, not just related to the virus that we're talking about right now. So accreditation really is a risk reduction activity, and it really puts in place a framework and an organization to follow when things like this happen, and to really mitigate the risk to patients from acquiring risk. Obviously, this is an evolving situation, but I would really urge patients to be, if they're still planning to travel for their care, that they really ask the organizations they're going to, what precautions they have in place, what guidelines they're following. Are they using the WHO? Do they have a clinical accreditation? It's very important that an organization has put themselves out and has had a third party come in and validate their care before something like this happens. And it's my understanding also, and Dr. Zane can certainly speak to this, but that patients who are more vulnerable physically might be more susceptible to this virus, which also makes sense. So I think that also has to factor into the decision as to whether to continue to travel or not.
I'm going to make a couple comments about what was said by my colleagues, both Ran and Karen. The thought that cancer patient today in China may not be getting their treatment and so on is not unique, unfortunate, but not unique. Actually, the classic example that took place in the past would be when the hurricane in Puerto Rico happened. So initially they said, okay, only 140 people, or not only, but 140 people died from the hurricane. When people looked at how many people actually had very poor clinical outcome or died because they lost access to treatment and access to hospitals, the numbers were multiple folds higher than the ones who died directly related to that. So I think this is a much bigger dimension than even possibly the 1,000 patients who unfortunately died due to the coronavirus, is how many patients may actually have poor medical outcome or die because of lack of access now to therapy. And now to how to deal with it is a difficult issue, but I would argue there may be room for telemedicine in these situations, especially as when Karen talking about difficulty trying to make judgment about when to travel and where to travel and limitations on travel. And if travel is deemed not possible for any of the reasons mentioned, then there may be some room for giving local support through telemedicine. There are many things which, again, lessons learned from other crises. Many things can be done to temper the need for immediate medical care until this crisis is over. And I think some effort should be put in that aspect. I do very much support what Karen said about process of accreditation, establish procedures for infection control, establish procedures for crisis management in advance. It's very hard to establish these procedures or crisis management teams and so on at the time of the crisis. It has to be done in time. It has to be, people have to be trained for it. It has to be practiced. It has to be, so I think going through processes like accreditation will allow healthcare facilities to be ready anytime, anywhere when a crisis does actually happen. They have at least a minimum level of training and procedures in place.
I think that's very, very helpful. And, Karen, I think that probably, not the hospitals that have infection control things in place, but I think that other players in the industry probably didn't think about that infection control aspect of patients traveling for medical travel, going to countries, coming back. And I think, they might even say, some of the buyers in the industry, the hospitals have that covered, it doesn't necessarily matter. I think the fact that global healthcare accreditation incorporates that is extremely important, because you're looking at the long-term health and safety of the patient, the hospital they're traveling to, coming back. I think maybe after the fact that this is going on with COVID-19, I think people are going to be more reassured that there are processes in place, there are standards in medical travel along with accreditation to actually prevent this, and it was thought about beforehand. And I think it's important that patients are thinking about this, because there are, just like in any other industry, right? There's poor hospitals and clinics, there's average hospitals, there's great ones. I think there's a lot of patients who travel to, it could be substandard facilities in countries, or ones that, don't have the standards or the infrastructure or the staff on place, not just for infection control, for everything. I remember when I was in the health insurance industry, there was a clinic in Costa Rica trying to attract Americans for heart procedures, and they were always calling on us as a third-party administrator to send them heart patients. And we never did, but years later, one of the major hospitals in Costa Rica told me that this clinic had asked to borrow a defibrillator 1 week because they were having a heart patient coming from the US, and they didn't have a defibrillator because they were not prepared to do heart procedures. So don't assume, if you're traveling for care, if you're going to smaller facilities that might not have the international accreditations for the staff on place to deal with this, is you need to make sure that these places have everything in place and have that infrastructure and are quality and have the accreditations in place. So Ran, A question I have for you is, how does something like this, because I think as an industry, you always need to be prepared. It could be COVID-19 today, it could be something tomorrow. How does this affect your business as a medical tourism company, or China outbound medical tourism? Are you seeing any type of a shift because of this?
Well, we do keep receiving, even these days, inquiries about coming to the US for treatment because they don't have much options in China. But when in terms of actual traveling, especially during this sensitive period, we will be very cautious about selecting patients and have to get medical clearance from their treating doctors in China. And these does impact our daily business, because more patients are actually thinking about the remote second opinion. As Dr. Zhang mentioned, telemedicine is becoming more popular during this time, and when they are thinking actually coming for treatment, it's just more efforts are required for for example, they have to be put in quarantine for more than 14 days before coming. You have to make sure that they're not being exposed to unnecessary virus or infected people in the airport or in the hospital also.
Mm-hmm. Any final thoughts by Dr. Zhang, Karen, or Rand before we kind of wrap up the webinar?
I mean, my final thought is consistent with what I said earlier. I don't think anyone need to panic. Rather, everyone need to follow evolution of this epidemic and guidelines and recommendations put forth by the World Health Organization, CDC, and local health entities, and to follow it carefully. And I think I hope that it's gonna follow similar previous viruses in which it's gonna peak soon if it had not yet, and then start declining and life go back to normal. It's very important.
Karen or Rand? Yeah,
I agree with what Dr. Zhang has said. I mean, it is evolving. Past epidemics have shown that things do get back to normal within a few months, and certainly a year from now, hopefully things are just as they were prior to moving forward. I do think accreditation, since with an accreditor, I think it is a risk reduction activity, and for buyers, patients, facilitators who are really thinking of where a patient should go, they really should seek out that accreditation, both the global healthcare accreditation and a clinical accreditation, because they will have done these risk reduction activities in advance. And while a crisis is going on, they already have a team in place. They have policies they can follow. There is a protocol in place, and they know where they can go for guidance, who are the sources of authority that they should be leaning on for direction and moving forward. So I think it's very important. With GHA, we look at care along the entire care continuum, from the time they're first making that decision to the time they get back home. Each of those has various risk points, and the communication between the patient and the organization is very, very important. And certainly now as well, it's very important that hospitals be transparent with their patients who might be thinking of traveling, and have a very open communication as to what plans should be put in place.
Yeah, I think it has been a very kind of difficult start for people from this year, especially Chinese people and people who have critical illnesses. I do hope, as Dr. Zhang mentioned, this will be over or under control very soon. And based on the number, day by day, I do believe it's going to be under control soon, and people will go back to their daily work and seeking for proper treatment and do normal activities as usual. So
great. Want to thank you all for coming on, especially this early East Coast, West Coast. We'll be making the webinar available, to the industry. And then also, I just want to encourage everyone, this webinar and the education we provide is through the support of our members. So I encourage everyone to join the Medical Tourism Association. We launched some new membership benefits this year to really address some of the gaps in the industry, such as helping hospitals and clinics understand patient flow, workflow, their email communications, what's on their websites and their corporate collateral. So we're doing a lot of things to help fill the gaps and help hospitals, clinics, and facilitators succeed more. If any of you haven't seen, we consolidated all of our websites this year into one at medicaltourism.com with a new look and feel. And it's been pretty exciting because we're getting a lot more patient inquiries from all over the world. We're now added to all of our members where they get a featured page on the website, whether they're a facilitator or hospital or clinic, so that patients can or buyers can find them and request more information. We're trying to really help fill the gaps of connecting the industry together. I also encourage everyone to go through the Certified Medical Tourism Professional Program. I think it's really important for people. If you're a hospital, you've got accreditation. If you're an individual, how do you understand what are best practices, how to do things the right way? I think something like this, that we're dealing with as an issue today in the world, encourages the importance of more education and training. I know the CMTP course is offered by GHA with about 10 modules, but there's about 43 extra continuing education units, where you can watch 43 different videos online after you become certified to teach you all different aspects and niches within the industry. So I think the industry, this is a wake-up call of let's get more educated, let's cooperate more, let's collaborate, let's set the standards. If anyone has any questions, feel free to email us, and we're happy to answer those questions later for you offline. So thank you, everyone, and have a great week.
Thank you.
Thank you.
As well, thank you.